Aneuploidy means abnormal no of chromosome. Most common trisomy. Trisomy 21, Down syndrome. Causes of Down syndrome. 1. Maternal meiotic non-disjunction. 2. Translocation, T14, 21 and T21, 21. 3. Abnormal pair of 21. Facial abnormalities in Down syndrome. Mongoloid facies. 1. Brushfield spots in iris. 2. Upslanting palpebral fissure. 3. Epicanthal fold. 4. Protruding tongue. 5. Low set ears. 6. Flat face nose occiput. 7. Brachycephaly. Limb abnormalities in Down syndrome. 1. Simian crease, single transverse crease. 2. Clinodactyli, curved fifth finger. 3. Sandal gap, more space between first and second toe. Visceral manifestation of Down syndrome. 1. Heart defect MC. 2. Brain low IQ. 3. GI defect, atresia. 4. Hypothyroidism. 5. Leukemia AML, ALL. 6. Presenile Alzheimer's. 7. Atlantoaxial instability. Most common cause of death in Down syndrome. Atrioventricular septal defects. Recurrence rate in Downs. Generally 1%, but if T21, 21, 100%. Second most common trisomy. Trisomy 18 Edwards syndrome. External facial manifestation of Edwards syndrome. 1. Prominent occiput. 2. Small eyes microphthalmos. 3. Short neck. 4. Dysplastic ears. External manifestation related to limbs of Edwards syndrome. 1. Clenched hands with overlapping fingers. 2. Dorsiflexed toes. 3. Prominent heel. 4. Rocker bottom feet. 5. Limited hip abduction. Internal manifestation of Edwards syndrome. 1. Heart defects, BSD greater than PDA greater than ASD, same for Patau syndrome. 2. Horseshoe kidneys. Scalp defect associated with Patau syndrome. Aplasia cutis. Patau syndrome is trisomy of 13. Features related to fingers in Patau syndrome. Clenched hands with polydactyly. CNS defect associated with Patau syndrome. Holoprosencephaly. Features of Patau syndrome. 1. Aplasia cutis. 2. Microphthalmos. 3. Dysplastic ears. 4. Cleft lip palate. 5. Missing ribs. 6. Cryptorchidism. 7. Clenched hands with polydactyly. Turner's syndrome karyotype. Loss of 1x, 45, XO. What feature can be seen in Turner syndrome at infancy? Lymphedema involving foot, hand, neck. In neck it's called cystic hygroma. External features of Turner's. 1. Short stature. 2. Web neck, loose skin fold. 3. Shield-shaped chest. 4. Widely spaced nipple. 5. Small fingernails. 6. Shortened fourth metacarpal. 7. Cubitus valgus. Carrying angle in Turner's. IQ in Turner's incline. Carrying angle in Turner's. More than 135, cubitus valgus. IQ in Turner's and Klinefelter. IQ normal in Turner's. Low in Klinefelter. Internal manifestation of Turner's. Heart bicuspid aortic valve, coarctation of aorta. Horseshoe kidney. Infertility. Pseudo-Turner syndrome aka indifference. Noonan syndrome. 1. Gender can be both. 2. IQ low. 3. Streak over ear cryptorchidism. 4. Internal manifestation pulmonary stenosis. Noonan syndrome gene and inheritance pattern. PTPN gene. autosomal dominant. Klinefelter syndrome features: tall stature, less facial axillary hair, gynecomastia, cryptorchidism. Complications in Klinefelter: CA breast, extragonadal germ cell tumor. Microdeletion syndromes example: 1. DeGeorge syndrome. 2. Williams syndrome. DeGeorge syndrome chromosome and problem lie in 22 chromosome, defect in thymus and parathyroid. Affected chromosome in Williams syndrome. 7. Features of DeGeorge syndrome: Catch-22, cardiac defect TOF, abnormal face, T-cell deficiency thymus, cleft lip palate, hypocalcemia PTH, chromosome 22. Features of Williams syndrome: 1. Elfin face. 2. Hypercalcemia. 3. Heart defect aortic stenosis. 4. Low IQ. Elfin face: prominent forehead, puffy eye and cheek, wide mouth. Facial abnormalities in DeGeorge syndrome: hypertelorism, low-lying ear, thin upper lip, small jaw. Genomic imprinting disorders: 1. Prader-Willi syndrome. 2. Angelman syndrome. Prader-Willi syndrome chromosome 15. Deletion of paternal allele, disomy of maternal allele. Prader-Willi syndrome fetoris: massive obesity, ghrelin high, small almond eyes, small hand feet, hypogonadism, short stature, low IQ. Angelman syndrome chromosome 15. Deletion of maternal allele, disomy of paternal allele. Features of Angelman syndrome: seizures, hypotonia, low IQ, speech defect, ataxia. Angelman syndrome is aka happy puppet syndrome.